Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help you and your families to feel better, function better, and live as many quality disease-free years as possible. I want to wish everybody a happy Labor Day weekend. And for those of us and those of you who are retired and spent your years laboring or are currently laboring in whatever capacity, take a day off, and I pray that you and your families have a wonderful weekend, relax, and hopefully spend time together like I plan on doing. I take every Labor Day off. I take a long weekend after a very busy summer in my office, and it's a pleasure spending time with you today, and I hope that whatever you're doing today, it's a blessing. And we look up and we say to ourselves, Luke 1:37, for with God nothing is impossible. And we take that attitude into my show. We do that each week. But this week I have a new Bible verse for you because my wife Stacy had slipped in a note this week into my lunch bag. And it's 1 Corinthians 10:31. So then whatever you eat or drink or whatever you may do, do all for the honor and glory of God. 1 Corinthians 10:31. So whatever we eat or drink or whatever we do, let's do for the honor and glory of God. And that's what the By Design message is all about. Let's follow God's design, not man's design. And I think after last week's show on whole grains, hopefully now you have a good understanding of the anatomy of what whole grain is and how man has stepped into God's plan, because whole grain from biblical times doesn't even resemble whole grain today because of what man has done to the actual whole grain. And we talked last week I wanted to make the point that I wasn't defending whether or not you should consume whole grains due to its gluten content. Well, today I want to discuss gluten because obviously it's all over the news. It's all over our supermarket shelves, things called gluten-free. So we're going to go from whole grains. Whole grains contain gluten. You learned that last week. If you need to go to my YouTube channel, each week I upload the video and the audio of my radio show. So you could go back to the whole grain show and learn about that whole grain kernel. Now, gluten is something that we first have to take the anatomy apart. What is gluten? We have to define what it is, because basically the gluten intolerance today, what we call gluten intolerance, gluten allergy, is real, and it's basically wheat has been eaten right since biblical times, but the wheat that we're consuming today is very different than the wheat of biblical times. So when you see your supermarket shelves, devoted to eating gluten-free, restaurants trying to keep separate menus and such, there's a real reason why. This is not like a fad. It's not a fad because people's health, the byproduct of gluten, many times affects people's health. So let's define what an allergy is versus an intolerance. So if you have your health journal out, there's a big difference between an allergy and an intolerance. A gluten allergy is something that's going to cause an IgE reaction. That's capital I, small g, capital E. That's a immunoresponse. So you have these things called immunoglobulins, which you could get tested in your blood. And the IgE immune response is basically you're going to develop, let's say, hives or asthma or itchiness, tightening of the throat. Even an anaphylactic reaction is the sign of an allergy. Okay, maybe we've heard about the kids with peanut allergies with the anaphylactic reaction, and we need the EpiPen. God forbid they have an anaphylactic reaction. We want to be able to administer medicine to save their life. So that's the same with a gluten allergy. People have real allergies to gluten, which again is contained in barley, wheat, and rye. So this gluten thing, which I'm going to define for you in a minute, there are allergies. Now, intolerance is a little bit different. Many people have gluten intolerances and just don't know they do. This is a reaction that could occur sometimes hours and days after eating the food. So sometimes people go on years and years and years and they have a reaction, but they don't even know that the reaction that they are having is because of gluten. So this intolerance is far more common than the allergy. Okay, so that's how we're going to set up the show today, all right? And when we look at the show, when we talk about gluten allergy or intolerance, we're going to take a look at mostly the intolerance factor because, again, many people go many, many years and don't even know, including me, by the way, that they have a gluten intolerance. So what is gluten? Gluten is glue. And it makes dough easy to work with. So if you think about cornbread, which doesn't have gluten, it tends to crumble, right? But dough that has gluten is stretchy and it rises well. So that's basically what gluten is. It's a glue. So wheat, barley, rye, like I talked about, even spelt, this contains gluten. And it's made up of two proteins that have been, shown to cause reactions in people. So here's gluten. It has these two proteins in it. One of them is called gliadin, G-L-I-A-D-I-N. The other is gluten, G-L-U-T-I-N-E-N. These two proteins are contained in gluten, and they're the thing that make up the intolerance. So now when we look at the modern world of gluten intolerance, the way we eat, wheat today is very, very different than biblical times. So in biblical times, they use something called einkorn wheat. And if you ever see pictures of it, it barely resembles the wheat that we use today. The wheat we have, today is called dwarf wheat. And this is the third largest crop behind corn and soy. Now, if you've listened to my shows, you understand that corn and soy these are inflammatory grains. So we're growing in our country corn, soy, and then this dwarf wheat. Now check this out. Genetically, the dwarf wheat contains four times more gluten than it had 50 years ago. So you have to ask yourself, did God all of a sudden put 4 times more gluten in our dwarf wheat than it did just 50 years ago? Where did that come from? Well, it came from man. It came from man genetically modifying, maybe you've heard of GMOs, genetically modifying our food and changing the actual structure of the food. All right. So that's where this GMO debate is out there in our country. And you should tune into that because man is changing the structure of our wheat, of our corn, and of our soy. And they're doing it genetically. So I'm not going to spend a lot of time on that because we want to get back to gluten. So there's a huge difference between the concentration of gluten in wheat, okay, and these new proteins than there was in biblical times, okay, because we're using a different type of wheat and we're genetically modifying it. And so it's overwhelming to our body. So here are our bodies, right? Here are our cells, and our cells are taking in all of this extra gluten that it wasn't designed to do, and we are responding to it with allergies and intolerances. So damage from gluten falls into basically 3 general categories. Okay, there's digestive problems, there's mental and emotional and neurological problems. That's category 2, mental, emotional, and neurological. And the third one are autoimmune problems. So these 3 categories, as a doctor, somebody who does this, whenever I hear a patient tell me about their lives, tell me their history, we're looking at blood chemistry, and always in the back of my head, I'm asking myself, do they have a gluten intolerance or a gluten allergy? And we start breaking it out into these 3 categories. So if you think that gluten is only a digestive problem, that's a big mistake, okay? Because again, this gluten can leak through the damaged intestine. That's what it does. It's called leaky gut syndrome. It leaks through the damaged intestine and actually causes autoimmune reactions like Hashimoto's disease, RA, okay, the autoimmune diseases that we went over many weeks ago. This inflammation caused by this damage triggers, okay, this triggering effect by the gluten can trigger things like obesity, insulin resistance, diabetes, and heart disease. So this is a real serious thing, guys. This is not like, I have a bellyache or I have some diarrhea or constipation because I'm eating gluten. All right, our autoimmune incident rate is off the chart, and we have to address some of maybe the food intolerances, and gluten is one of those things. Graves' disease, type 1 diabetes, rheumatoid arthritis, and then when we get into the digestive problems like reflux, inflammation of the bowel, irritable bowel syndrome, these are also symptoms and diseases and conditions many times caused by gluten. Now again, this is a gluten intolerance. Skin disorders like eczema, psoriasis, which by the way is also an autoimmune, hives, dermatitis. These are things also can be caused by gluten. Neurological conditions like MS, cerebral ataxia, migraines, depression, dementia, Parkinson's, attention deficit disorder. Okay, the list goes on. These are some of the things caused by years and years of gluten. And again, many people don't know that they have an intolerance, okay, because they don't have an allergy. They're not having the anaphylactic reaction. You know, their body doesn't go into an immediate itchiness like you see the kids have or some of us have because we have an allergy. So again, I want you to keep those two things clear: allergy and intolerance. So how do we diagnose this? Basically, here we are, and we're saying to ourselves, okay, Proodian, I really want to know if I have a gluten allergy, which you probably say to yourself, I don't, because I don't have any of those severe responses. And if I do, you definitely want to get yourself to your doctor to do a blood test, okay, a celiac blood test. And the other thing is a stool biopsy. So stool biopsy is still the quintessential test for looking for immune antibodies, and this can greatly help us. Okay, so those are the diagnostic ways. You take a thorough medical history, you do a stool biopsy, blood testing, and really listening to a patient about their digestive condition, their neurological condition, and looking at autoimmune, any type of autoimmune. Then we're going to single back to or look back to whether or not we have a gluten problem. So this is a much cheaper way that a lot of you guys, and I tell my patients to do this all the time, than to do a stool biopsy or get blood test. Just for the next 4 to 6 weeks, go gluten-free. Okay, just go gluten-free for 4 to 6 weeks. There's plenty of free information online about how to eat gluten-free, what gluten-free means, gluten-free dietary protocols, and then watch your body's response to a gluten-free, and I always throw in there dairy-free too, because I have my own opinion, which I've expressed pretty strongly on the show, that when you look at dairy today and what we're consuming in our dairy products, once again, man has greatly altered dairy products. So dairy, and now we're talking about gluten, if we did that for 4 to 6 weeks and see how you and your children responded, I can almost guarantee you feeling better, having better mental clarity, thinking better, skin clearing up, anything digestive is going to improve. So this is a real down and dirty way just to test me. No one ever passed away because they weren't consuming enough gluten. So by going gluten-free for 4 to 6 weeks is certainly not going to harm you. And it's something that I would challenge you to think if you'd like to try this. Okay, and then if you reintroduce gluten back into your life after 4 to 6 weeks, see how you respond. How do you feel? Write this stuff down in your health journal. And then at that point, if you need help, you could come and see a person like me or someone who does this for a living, because then you might need a little bit more help medically. Even I'm not a medical doctor, I'm a chiropractor, but from a nutritional perspective, those of us who specialize in nutrition can help you take it a little bit further. Now, one of the things we want to be aware of is when we come off wheat, we come off gluten, many people immediately jump into eating gluten-free product, and they indulge themselves in things like gluten-free brownies, gluten-free pasta, gluten-free pancakes. Remember, we don't want to just overload ourselves with carbohydrates, okay, just because we're removing the gluten. So it would be better for us to, if we're going to avoid grains, stick with protein. Remember, vegetables, incredibly important that we're consuming an abundance of fruit and vegetables. And of course, healthy fats. Healthy fats are very, very important. And if we're removing the grain, we're getting plenty of fiber in our vegetables and our fruit. Okay, so this modern wheat is causing a huge problem. Modern wheat is causing a huge problem. Today, what I did was, this was a very interesting article that I found in DC Practice Insights magazine, September of 2014. This is a hot off the shelf, Marlene Merritt. I want to give her credit for this. It's an excellent article she wrote. Just a down and dirty, very simple. There are books written on gluten. There's Wheat Belly, which is a book you might want to pick up. And remember your kids. A lot of the kids with spectrum disorders, okay? ADD, ADHD, the spectrum with respect to autism and Asperger's. You have to look at food. Food is medicine, and you have to look at gluten intolerance, dairy intolerance as a starting place when dealing with kids. For you gals out there with thyroid disorders, gluten is directly tied into thyroid disorders. So you want to also, if you're dealing with hypothyroidism or Hashimoto's disease or any autoimmune, really address gluten. So I hope you learned something this week, and thank you for my wife Stacy for 1 Corinthians. And so then whatever you eat or drink or whatever you may do all for the honor and glory of God. Let's follow God's plan, not man's plan. Man has altered our food supply. Let's get away from it, because what he has done, I'm still looking for one piece of food that man has made that's good for me. If you know a piece of food that man has made that's good for me, okay, please send it to me, because I got plenty of foods that God made that are good for me. You've been listening to the By Design radio program. Me, Dr. James Proodian, for this episode. If you want more information about me, please go to ProodianHealthcare.com. Become a blog member. I blog every Wednesday. Have a blessed week, and God bless.